Welcome back to another episode of the Braun Performance and Rehab Podcast. Joining me today is Mark Jamison. Mark and I are going to be discussing the Oro Muscles device, in particular, how to apply it for use in sports performance and sports rehabilitation settings. The Oro is an absolute game changer, and I've been so impressed by the impact it's had on our patients and on our outcomes in the clinical setting that way. I highly recommend you check out Oro if you have not already. Episodes like this are made possible by both Oro and ISOFIT. For more on Oro and ISOFIT, you can check the description below. Enjoy. Mark, welcome to the podcast. I'm super excited to work with you today, man. Thank you so much for being here.
Yeah, excited to be here.
For people who aren't familiar with you, or maybe they haven't heard this amazing company called Oro before, would you mind filling them in a little bit about who you are, all the great things that you do, and then a little bit about this Oro Muscles company?
Yeah, for sure. So Mark Jamison, I work as the Associate Athletic Director for High Performance at Southern Illinois University, Edwardsville. I'm in my 9th year here, primary strength and conditioning coach, but in that role, within a high performance setting, oversee sports medicine, sports nutrition, sports psychology, and sports science. And then I work directly with our men's soccer program and every return to play athlete that we have. So anyone that gets injured, I work with individually and help kind of that progression between PT and more of the rehab side to that mid rehab and late rehab stage, and we'll help them transition to on court, on pitch, on field, whatever sport that is. And then Oro Muscles is a company I work for, as well as the director of customer success. Really just work hand in hand with every client that we have. And what Oro Muscles is it's been around for 5 years. It's gone through quite a bit of a validation process. It's a medically validated surface EMG device that is Bluetooth and has an IMU in it and an AI algorithm that helps expedite the data processing stage. Because I don't know how familiar you are with EMG and using EMG, but it can be very difficult to process that information because there's typically a lot of data artifacts, and to be able to analyze that information can take a lot of manpower and a lot of time. And the IMU, what that does is it's a 6 degrees of freedom, so tri-axis, accelerometer, and gyroscope. So that kind of helps determine commonalities in movement. So it can actually kind of predict what movement pattern is being done. And then it will read in microvolts, the muscle activation. So how much actual muscle intensity is there is kind of the way that we present it. It's called muscle intensity. And then the time and retention. So say you're doing a long yielding isometric, how much time was the muscle under contraction during that time? We can present all that information live on a biofeedback app. So the RMS value is provided in the form of a bubble, where if the bubble gets big, that's the rate of muscle contraction. And then the AI algorithm essentially really helps partition the data, so we can actually expedite those reports and get those to really, really fast, as opposed to waiting for a week or 2 weeks, in a lab setting to try to get that information.
Yeah, it sounds like it essentially takes the concept of surface EMG, but makes it significantly more accessible and applicable to what we do on the day-to-day, whether you're in a strength and conditioning or a rehab type of setting, whatever it is that way. To your point, I think most people look at surface EMG and they say, there's no way in hell I can use this in clinical practice. Yeah. And then they look at something like this and it's like, actually, I can use this quite a bit, and I can think of a lot of different application points that I'm sure we'll get into. But I think in general, it takes something that I think everyone kind of recognizes is generally good. I think there's still some pitfalls with surface EMG, and we can obviously get into that as well. But in general, this is something that gives us a whole lot of good information about how someone is doing something and are they actually getting what we want them to get out of it that way. And obviously, every individual is a little different. They're built a little different. They're going to move a little bit different. So it allows us to kind of take a deeper look under the hood, if you will, to look at how someone goes about strategizing their movement patterns. What muscles are they actually using? We might look at it and say, well, visibly, it looks like a quad dominant movement. And then we do a little bit deeper assessment and find actually they're barely using their quads at all here. So I think it really gives us a new lens to look through as it comes to this entire concept of high performance and rehab that way.
Exactly. I mean, if you look at everything that is currently used, and I think the good news in terms of our fields of whether it's sports science, sports medicine, or sports performance, a lot of people it's common now to use more of a criterion based approach, when it comes to like return to play and things like that. But everything that that we track and use as current KPIs, if you look at them, they're all output measurements, right? It's all force output measurements. It's all speed and rate of movement. But we can't quite identify where that force is coming from. We know that the force is being applied. So, say it's a NordBoard example, right? We know that the force is being applied from the hamstrings. We just don't know which one. So if, say, there was a biceps femoris long head injury, and you might pass the NordBoard assessment, but we all know athletes are the great compensators. They're going to find a way to pass a test. They're that good at that. But if we can put surface EMG on like Oro, we can now identify, okay, hey, they passed in terms of the force output and the symmetry looks good, but there was relatively no muscle activation from the biceps femoris. So there's clear compensation. And now we can kind of identify that lack of neural drive earlier on to be able to address those things and make sure, okay, instead of that would clear you to maybe start running and progress to sprinting, they're not quite ready for that. We need to make sure that we're actually addressing that muscle tissue.
Exactly. And it allows you to kind of take not only in the return to performance and return to play process, but even just in general with the interventions you're doing that way, are you doing what you think you're doing, right?
Right.
So going back to the example of the Nordic that you just gave, just kind of beating that for a second, people might use Nordics for a testing purpose, but they also might use it for a training purpose. And if you have that patient who comes in with a hamstring strain, you might think you're loading the injured tissue when in reality you forget about all the other portions of the hamstring. So, it's entirely possible that patient comes in with injury to one part of the hamstrings, like you just mentioned, biceps femoris, and then you do the Nordics for a training tool and find actually we're just loading, semi-T and semi-M. I just made that up on the spot here, but we're loading those a lot more than the injured tissue. So then it becomes kind of a game of what would actually be instead of, what we feel is possibly the best exercise, what's the best exercise for this athlete based
Right.
on how they're presenting. And in this case, the best exercise is going to be what actually gets load through the tissue that we need to get load through. And I think that that's the in-depth kind of analysis that a lot of us have been missing in this
Mhm.
sports science and high performance field for a long period of time. And I'll take it a step further. I look at the quads and all this debate online, which I don't want to get too far into this about, can you preferentially train the VMO and so on that way? And, again, I think it's different for every individual, but you can certainly almost self-experiment with each person that you work with and find out what actually elicits the best adaptations in them specifically as you're working with them. And it kind of takes that individualization of training approach to a whole new level, I think.
Exactly. And I mean, I think that's something that we found is, there's many exercises that we, assume will elicit a certain muscle response. But again, there's a lot of different factors, right? There's the factor of what is the form and technique of that athlete that's doing it? What is their, say it is an injury, what's their pain response? If there's a high pain response, we know there's going to be some kind of compensation and a lower neural drive. But then even if we can identify, okay, so VMO, for example, which exercise elicits the highest muscle activation response? Okay, that's good, but is the loading principle the most efficient or most effective loading principle, right? And I think that's one thing that is difficult to understand unless you have information like surface EMG. For example, I have 3 ACL girls and say it's leg extension, right? And, we tend to get a pretty high VMO response with that. Now, some might need more tibial internal or external rotation to actually get a better VMO response. And that's, again, a great individualized thing that we can kind of find. But once you've, kind of figured out, okay, what position do you need to be in to get that muscle response? Okay, now what do you need to get a high muscle response? Is it load? Some athletes do not respond really well to high loads. Some athletes need to kind of train that muscle tissue to fatigue to really create a high muscle activation response. So now we can actually identify that. Okay, is this an athlete that might need myo reps, to try to get the best muscle response, or is this someone that can really respond well to low rep ranges with really, really high loads? And that's actually what they need. So now that we have the information, I mean, you can, instead of waiting for a block to train that, so 3 or 4 weeks or something like that, we can identify that within 1 or 2 sessions and really make sure that we're, optimizing every single training exposure we get with our athletes.
Like what's the learning curve to something like this? How important is it to get things set up in the right locations and your palpations that way? And is there really any limit to the musculature that you can assess that way? Is it mostly extremities, or could we look even deeper at like abdominals or that sort of thing? Or
Yeah, I mean, it's, the nice thing is the learning curve is extremely low. We follow the SNIAM guidelines, and that's provided to every client that has it. So So long as you know your anatomy, it tells you exactly the orientation of what the device should be. And really, it just follows the pronation angle of the muscle. So then from there, it's obviously the SNIAM guidelines are going to recommend the middle of the muscle belly. But the nice thing too is, go back to maybe the biceps femoris. If it's more of a proximal strain that the athlete had, you can put it more proximal to that muscle tissue. You can actually kind of go right over where the injury site was, because so long as it's on any surface muscle, it's going to read, easily up to 10 millimeters within the muscle and get a pretty good response. To your point of, how accurate do you need to be in terms of the placement? The nice thing is it has a 3 centimeter error rate. If it's a different practitioner that's applying it and maybe isn't as good with their palpation techniques, they can typically find the exact same kind of muscle response within that 3 centimeter range and still get the exact same readings that you would have gotten from a different practitioner that applied it. So the learning curve from a placement standpoint is pretty easy. Obviously, sports medicine is very good at it. It's what they do. They're hands-on. Strength and conditioning, that might not be as much. The guides make it very, very simple. And the 3 centimeter error rate does help. To answer your question of, exactly what are the potentials for muscles, you can put them on scaling, sternocleidomastoid, rectus abdominis, external obliques. We've done it all and gotten really good muscle response readings. So it's kind of limitless in terms of so long as it's an actual surface muscle, and then, there's a lot of Major League Baseball clients, and obviously they're pretty focused on, flexors and extensors around the forearm. There's a lot of small muscle bellies there, and there's a lot of crossover, but the one that we're trying to target, we're getting a good response on. So the exercises that, would bias flexion and should only get a muscle response there, we're seeing a good muscle response. So extremely confident. And obviously the validation studies from a medical standpoint, you feel confident that what you're trying to see, what you're tracking is what you're actually seeing.
I think that's the most important thing, is at the end of the day, the context is the king here, and we're trying to get a deeper look and appreciation at how the body moves. To your point, it's not just about an output measurement anymore. It's about how do we actually get that output in the first place. And I think that having the understanding that it's accurate and you don't have to really sweat some of the small stuff that I think we like to sweat in this space, because obviously palpation errors are, roughly 1 to 2 centimeters between clinicians that way. So understanding that a lot of the small factors that we often, I would say sweat when it comes to applying these things clinically, it sounds like we really don't have to worry about here, which obviously I like. I guess I'm kind of interested. You said it seems to be kind of limitless. Has there been any like really unique or cool application that you've seen with the Oro yet that's kind of like surprised you, or just kind of something you wouldn't have thought of yourself that way?
Quite a bit, to be honest. There's a lot of high level athletes, professional athletes that, will come in and be symptomatic of some pain response, but they're competing at a high level. They're hitting 21, 22 miles an hour on the pitch or whatever respective sport they're in. They're able to do some pretty amazing things. And then you go through kind of a diagnostic assessment, put Oro on just to kind of see, what response are we getting from certain muscles while we do this based on what their kind of symptomatic, pain response is. And as they're doing some of these exercises, we might be getting less than 15 microvolts. So relatively resting state muscle activity on patterns that should have a very high muscle response. So these athletes, essentially down-regulated certain muscle tissues that are really, really, important to certain movement to create, certain joint motion. And we're not getting much muscle response at all from that. Tried 3 or 4 different exercises and really not getting anything. And then when you take an even deeper dive, there's some atrophy in those muscles. But, these athletes, again, are competing at a really high rate, and now they're starting to become symptomatic. Then you test the opposite limb, and now you're starting to see the muscle response that you should get. And then you can start to take a look at, okay, what's maybe some of the synergistic muscle response? So where are the compensations coming from? If it's the quads, are they trying to rely heavily on rectus femoris for knee extension as opposed to VMO? Is it a pretty hamstring dominant person? So maybe say, you're just trying to do a quad set, and instead of actually using VMO to extend the knee, they're just trying to drive through the actual, table with their glute and their hamstring, right? Just they've learned these different compensations to create these joint mechanics, and they're not firing the muscle at all. So I think that's been a pretty outstanding thing that we found, is that, we can identify this pretty early on, based on an athlete's symptom response to pain. Because now with our diagnostic assessment, we get a pretty good reading right away. Okay, because otherwise we could see they're clearly performing these tasks. They're able to pass manual muscle tests. They're able to pass goniometric measurements, but Now we understand how are they able to create that range of motion? How are they able to create that force? It's not coming from where it should come from in terms of a muscle response.
Yeah, that's really interesting. And I didn't initially think about Oro from a diagnostic standpoint, but it makes a lot of sense that way. And obviously, I think it's important to kind of establish the baseline metrics in this spot if you can, in the sense that everyone's going to move a little bit different and their
Mhm.
strategies are all going to be a little different. So I feel like having some kind of baseline to compare to when things do go wrong or when they are in pain and understand how either pain is impacting their body and moving different, or they're moving different and that's what's causing the pain. But having that baseline to compare to, I'd imagine, is absolutely essential in this piece that way.
And I think probably the most impactful component of Oro is the biofeedback app. Athletes now can see a muscle contraction and they can feel, right? So you might have given them certain rehab exercises and they might just go through the motion. And again, they're performing the task. But if you say, like, how does that feel, right? They don't have any context because they're not quite even, they're not even sure which muscle you're talking about. And you could even palpate the muscle. When you ask them, the context is, it feels fine, or, it doesn't hurt or whatever. Now they can actually, okay, you see where the unit is at. If it's on VMO and we're doing some simple leg extension or quad sets, now you can actually see that muscle firing on the RMS biofeedback. So that bubble gets larger and larger. Now they can kind of see, okay, that's what it should feel like while I do that exercise. I think from a practitioner standpoint, that's been massive because all the maybe verbal cues that you would give an athlete, you can see which one they respond best to. If they don't respond very well to a verbal cue, let's try an external cue, right? Which one do they respond well to? Or we might have to adjust the movement or create a modification in terms of that movement. Again, to try to identify what is the most advantageous loading position for that athlete. But that's been the biggest component of it is, all the athletes that have used it, whether it's at SIUE or it's a lot of our clients, asked to use it every single time they train. Because that mind muscle connection is just accelerated in terms of their ability to understand how the movement should be performed and what it should feel like while they perform it.
Yeah, it's funny that mind muscle connection piece. It comes up a lot when I'm talking with individuals in the bodybuilding space, and I'm starting to notice that there's significantly more of a overlap between bodybuilding and strength and conditioning. How important do you feel like it is for athletes to be able to really feel and engage different muscle groups as it relates to performance and, hopefully preventing injury that way? As important does that really come back to at the end of the day?
I think it's extremely important. I think our goal as a strength and conditioning coach should be, or a practitioner should be, to try to educate the athlete on, the why for what you're doing. Obviously, that they're going through the how that you get to whatever adaptation it is. That's not quite enough. I think that's one of those. If you're doing an RDL position, and it's hard, I think, to say you should focus on feeling this in your hamstrings, because sometimes if we over cue how it should feel in the muscle, that athlete might go into a bending strategy as opposed to truly getting a good hinge because they want to try to feel it more in the hamstring, right? So typically we tend to coach the movement pattern first, and then we kind of focus on the muscle response, which I think in a global setting, if you have a lot of athletes going at a time, that's the best way to do it, is to make sure obviously that it's an orthopedically sound movement and they're doing it correctly from a form standpoint. But if you're looking at an athlete that's maybe had chronic issues, an athlete that is currently injured or in the late stage of coming back from an injury, they need to truly understand what that muscle response should be when they're doing a certain exercise, because it's important for them to kind of have that conscious awareness, not only in the weight room when it's a controlled setting, because we can isolate that tissue. To your point of like bodybuilding, I think bodybuilding techniques are kind of coming back into the strength and conditioning world, because it truly, if you do want to get a high muscle response, a lot of times isolation is the best way to do it. So some of those more compound movements are difficult to elicit a really high muscle response. So machines and things like that are a very good way to isolate those tissues. But as they kind of transition from that, so now I felt it in that more that isolated state. Now it's more of a, again, controlled compound movement. I can still have that awareness of, is my muscle contracting? Is it working when and how it's supposed to work? And then when it becomes more dynamic, so now it's more sport specific. Again, Oro, the nice thing with the Bluetooth, nothing with wires, surface EMG, and again, it's 10 grams, so very lightweight. Athletes barely feel or even aware that it's on. So we can transition that now to when they start to do sport specific movements. So pitchers are wearing it when they throw. They're wearing on posterior delt, infraspinatus, and don't even really feel that it's there, which is great. so they can go through their normal motion, and we can get an understanding of what's the muscle response, what's the muscle balance ratio between those two muscles when they throw. And again, now the athlete's a little bit more aware because, having something small like that on your body is almost like palpation while they're throwing. So I'm overly kind of aware of the posterior delt, and we can kind of educate them on here's when that muscle is actually contracting during the motion, during the way back motion, the release point. Here's when infraspinatus kind of takes over, and you should kind of feel that muscle contract when you throw. I think those are really important things because, again, now the contextual feedback from the athlete is significantly better, significantly more educated when you ask them as they return back to the sport, hey, how are you feeling? How does it feel when you do this? When you change a pitch, if it's a pitcher, when you go from a four seam to a changeup, how does that feel? Do you feel like the muscle is recruiting the way it's supposed to? Because now they have that immediate feedback from the app itself, and they have a better awareness of that mind muscle connection.
Right. That term awareness or being aware continues to come up. And, earlier you mentioned that athletes are master compensators. And I think that there's this disconnect that athletes have between their movement and what they should feel. And you kind of alluded to that earlier that way is they move, but they're not necessarily aware of how they move or how they get there. Obviously, we've talked about this in relation to assessment on our end, but, I think that concept of it being so beneficial and valuable to the athlete to have that bigger understanding of how they move and why they move a certain way is really essential as well. Because for lack of a better way to put it, I've seen a lot of variation as it relates to athletic movement lately. And I think there's a lot of different factors that could potentially, contribute to that. But for one, we've got some athletes who are playing four different sports, throughout their, throughout the length of a year, and they're exposed to a lot of different movement patterns, a lot of different stimuli. They're probably training and doing some strength and conditioning on top of that. And they're getting a wide array of movements and a really broad movement vocabulary. And I've got other athletes that only ever do one sport, and they're highly specialized in that one sport, and they've been specialized for years. So their movement vocabulary is not quite as broad, but it's a lot deeper in relation to that one sport. And then on the flip side, I also get some athletes who, they take a lot of time off and they sit around, they play video games, they watch TV. I'm not here to say that that's good or bad or indifferent or make arguments like that, but, they spend a lot less time moving than a lot of other athletes. And I think that all of these different kind of subcategories of athletic types are going to have different responses to movement, and they're going to have different understandings of how they move and how they get there. So obviously, the more we can kind of bridge that gap between how the athlete moves and how they perceive their movement to be occurring, the better off it's going to be. And obviously, it can start with something as simple as the iPhone camera, but in the world of high performance, the iPhone camera is not going to get you that 0.1% difference that you're looking for to set you apart from the competition. Because when you get to the levels that we're talking, D1, pro sports, it's really those small, minute differences that make the difference between winning and losing at the end of the day. And obviously, that same conversation carries over to injury as well. The more aware someone is of their body, I would imagine they're less likely to get hurt. And on top of that, the more aware they are of how they're moving and what the, optimal, I hate that word, but I'm going to use it here, the optimal way for their body to move and self-organize is, then, hey, maybe we're not going to see as many injuries, and, people like me are hopefully going to go out of business because no one gets hurt anymore.
I'd hope we could get to that point. I don't ever see that fully happening, but no, to your point, I've had some, like on our women's soccer team, a couple of ACL cases that used Oro all spring training, so a good 3 or 4 months of training with that device on. And again, I think really truly developed a pretty solid mind muscle connection. They were able to actually, maybe we didn't have it on because of, they come in straight from pitch to a training session or something like that, and we had to get through pretty quick. They would ask to put it on because they say, hey, I just feel like I'm not loading this side. I feel like I'm loading my other side, or I'm loading my hamstring more on this exercise. Can we just put it on? I just want to check that. Now that they're in season and they're playing, again, I think the feedback from them is significantly better. To your point of, can they almost identify when their body's compensating based on that understanding of the way they should feel when they do something? That feedback from them is I think significantly more impactful, because as they're going through a warm up, they can kind of identify, hey, I just don't feel like it's firing the way that it typically does when I do this, this pattern or this band activation series or whatever it is. And they can kind of give that feedback to the athletic trainer. They can give that feedback to us. and try to create an intervention immediately, right? Or maybe they need to make an adjustment or modification that day because they can kind of tell that fatigue is changing the way that they're moving because they have a significantly greater awareness of, how they should move essentially in terms of the progressions that we've made through their late RTP stage, not only from a weight room standpoint, but on pitch work. That feedback from them has been massive.
Yeah, I can certainly see where that would be incredibly helpful that way. And it's funny because the ACL concept comes up a lot on the podcast from surgeon standpoint, PT standpoint, athlete standpoint, and so on that way. And I'm really interested to hear what you've seen on your end from using the Oro in relation to the ACL cases that you've worked with that way. In particular, have you noticed any difference between quad activation with different graphs that way, like a quad graph versus a BTB? Because historically speaking, on my end of the rehab, I have a much harder time getting athletes to re-engage their quads after a quad tendon graft than a BTB. And I have to get a lot more creative and crafty, I guess I'll call it, with how I address quad atrophy and quad strength deficits following a quad graft than a BTB graft. But I don't really have any, surface EMG muscle data to back that up.
Well, I think the biggest thing is, especially with the quad graph, certain exercises that, we can really truly isolate the VMO as much as humanly possible, typically would cause a tendon pain response, right? And I think that would limit their ability to, create enough force output to get a high muscle activation response. And now that we can kind of put Oro on, it's not just, okay, everybody's going to do leg extensions. We're going to put them at 90 degrees of hip flexion, and we're going to start from 90 to 60-degree extensions, and we're going to do long length partials and all these different methods, right? We can actually identify for that athlete, okay, in that position, they're focused entirely on the tendon and how it almost, it's painful for the tendon because of where the graft was. Okay, now let's find which exercise they can see the muscle fire. We can get a good muscle response from. We get a high enough amplitude, but they're not focused on that tendon response. They're not focused on, okay, hey, this bothers I'm getting a tendon pain response. And I think that's been the biggest thing to identify early on is based on these different graphs that an athlete might have, they're going to have pain over the incision site essentially, right? Like, when you take away from a tendon to put it into the ligament, you've done essentially two surgeries in one on that same side. So there's going to be pain over that spot. It's not like we want to avoid pain per se. But we want to try to, again, find the most advantageous loading position to put them in where we get a high muscle response and they don't have that pain that's going to maybe inhibit the ability to get a high muscle activation. And I think that's been probably the biggest thing with the surface EMG is some people need drastically different positions to be put in, whether that's degree range of motion, whether that's, minor adjustments to a tibial, internal external rotation with certain extension positions to, again, try to get the VMO to fire early on. Because that's the biggest atrophy. Typically, the middle of muscle belly, when we do a lot of the, assessments over like middle of rectus femoris, there's not as much atrophy there. It's around that VMO. And I think a lot of that's because there's such pain response because the common graft site that we see is typically the quad tendon.
I think that's super interesting as well in the sense that, again, it kind of gives you that deeper look, but I'm also thinking about just the test retest component that could be applied here clinically, right? Like, say you do get that athlete with tendon pain. Well, I like to do a lot of different things to try and calm that down. I notice that the sessions tend to flow better when they're not in pain, but now it's like, hey, I can look at that and say, does this actually change what's occurring from the underlying mechanism, right? Like, hey, they're having tendon pain. I do some dry needling or I do some scraping or, whatever modality that athlete responds best to. Does that actually change what we get, or is it purely a, desensitization or neural driven effect there that, just, hey, it doesn't hurt as much, so, it's easier for them to go, or is it actually doing something deeper that we aren't recognizing that way? Because I think having that deeper understanding of the effect that we have with anything and everything that we do. I gave the manual therapy example, but we could say the same thing about isometric exercise, right? Like, hey, I set someone up in this position, we do this overcoming ISO for 45 seconds, and now this happens. I think that's really valuable information that we not just use clinically, but also we can kind of turn around and apply that in other components of this high performance team as well, like you mentioned before, right? Like I can go to the head coach and say, hey, look, I had the athlete do this in 45 seconds. We improved this by X amount. here's why it's important. Here's why we should do it for, all of our athletes in their warm up or all of their athletes after, participation in a game or whatever it is that way. I think that we're able to like really, hone in and redefine the way we do pretty much everything in the world of sports that way because, I think for a long period of time, we've started to see things like injury rates climb. And we've started to, point fingers at different things, turf and footwear and all these different things. But at the end of the day, at some point, we have to look ourselves in the mirror and say, what could we be doing better? And do we really think that what we're doing is doing what it's actually doing? And if it's not, then we better figure it out ASAP and get it back to where it should be.
And I think one really important thing is, athletes tend to get in routines, because you kind of mentioned like the warm up that an athlete might do, especially their kind of pregame or pre-practice routine. Baseball is always one that comes to mind, right? The band routine, the J band routine. I mean, it can be extensive, right? They do so many different patterns. They might do a lot of weighted ball routines and things like that before they even start to play catch. And what we've been able to do now with using Oro and getting feedback on that. Okay, instead of doing 12 different band exercises, 6 of those exercises didn't elicit any muscle response. It's a lot of you're just compensating through and with thoracic extension to try to create this range of motion for this exercise. Let's eliminate this exercise. We don't need it. We can focus on the 6 that get a really high muscle response because those are the ones that you actually feel, right? And now you can see that you're getting a muscle response. So that see and feel connection is there. We've decreased the amount of time it takes for you to warm up, but made it significantly more efficient. And you're actually more warm, you're ready to throw. And we didn't create a bunch of fatigue or create a bunch of high muscle response to the upper trap in some of these areas that we don't want before you start to play catch and throw. So I think that's been really huge, just to identify, what's the most advantageous, again, loading patterns for an athlete to use with their pre-practice routines and warm-ups. And again, to your point of like the isometrics, that's been, I think, something that's been, to be honest, one of the most profound things, I've identified it. When you dive deep into the isometric research, which I know you have, you start to identify, okay, we do so say it's external oblique. A lot of people always hammer out pull-off presses and chops and lifts and all these different rotational based or anti-rotation based patterns. You don't get a whole lot of muscle response from external oblique with those. You put them in a side plank position. You put them in a side plank with hip abduction, and it's a pushing isometric with the hip abduction. Now that it's external oblique response is extremely high. It's similar to, if not greater than when they throw with rotational based movement or when they hit. So I think that's been one of the really cool things is, okay, again, from a warm-up standpoint, like you mentioned, 45-second intervention, we have an athlete that, is an ACL that we've gone through and, did a, with the ISOFIT machine, which I know you're familiar with, that, that piece of machine has been phenomenal for my training, just because the adjustment to be able to change the settings of those things and do so many different movements in a short amount of time. But one of our athletes, would put it at 45 degrees with a split squat pushing isometric and got a really good response on one limb, but not the other limb. The other limb needed a 30 degree and they needed a deeper range of motion of knee flexion to actually get a much better muscle response. So now I can identify that right away. Hey, when they're going to do this intervention on the right leg, they're going to go at 45 degrees. When they go on the left leg, they're going to go at 30 degrees with the setting on the ISOFIT. And that gets the highest muscle response. It's pretty symmetrical muscle amplitude. And the outputs that they get after that, when they then go jump on the force plates or pull an IMTP, has significantly increased. I wouldn't have known that or been able to identify that in that short period of time or even ever without the feedback that we're getting.
Yeah, that's such an amazing point and takeaway that way, right? Like we often think that we have to train both sides of the body when we're doing unilateral stuff the same exact way to get the same response. And in reality, the two sides of the body work very, very different for a number of different reasons. And, one of the common things that I keep seeing come up over and over again is seems like almost every athlete I work with that has had any history of lower back pain is getting told they're having bulging discs or protruding discs and pressure on nerves and neural tension and that sort of thing. And I mean, 97% of Americans have lower back pain. So obviously, if there's issues with the nerves that innervate the muscles, then there's probably going to be differences between one side and the other that way. So if we don't look into how we perform in these different, movements and variations that way, left-sided versus right-sided, then we're never going to understand that and appreciate that. And to that point as well, the same thing could be said for all the different things we mentioned earlier, whether it's loading after ACL or, just understanding how someone moves a little bit deeper that way. The left versus right-sided assessment can drastically impact how you go about exercise selection and so many other factors that way, just from an overall like consideration of what range, what weight. You mentioned load earlier and how some athletes don't always respond well to higher load and others love it. You could throw tempo in there as well. I think you mentioned time under tension earlier in the sense that, different tempo variables will change what the athlete feels and what activation we get. And on that notion as well, I think this is another area where, going back to your point about, the bodybuilding and the mind muscle connection and how that's becoming increasingly popular and important, like, you can really easily see how the effect of like some pre-exhaust stuff fits into this. Or, going back again to redefining the warm-up, try those like ISO warm-ups. Try like 5 to 10 minutes of ISOs before your session and see what difference you get in the data as you go about your like planned session for the day. Because I find, at least from my own experience that way, that increased CNS drive that we get from the isometrics seems to just throw everything through the roof, and I get a much better training session from it. And obviously, I'm going to make that transaction every time because now I'm getting more results in significantly less time. And I think that's the other component to this, right? Is everyone's going to look at this and they're going to say, oh, but I don't have the time to do this, or how am I going to fit this into my busy schedule? And it's like, but you got to realize it makes everything you do so much more effective and efficient that it'll actually save you time on the back end if you invest it on the front end.
And it's, to be honest, I think a lot of time anybody hears about like new technology, like, all right, well, to your point, how long does it take to set up? How long does it take to process the information, process the data? Do I have any assistance? Is there any help, any recommendations when I see the data to better interpret that and be able to create a better intervention? From setting up the app with the athlete, selecting the muscles, putting the electrodes on the athlete, that's about a 30-second to 1 minute process. And then to your point, what we recommend is 45 isometric protocols to create an MVC. That way we normalize the data for whatever session you're going to run that day. That setup right there is quick. That's less than 3 minutes. And then, because it is just surface EMG, it goes along with every single thing you're doing. So whatever your baseline assessment protocol is, whatever your training program is, it goes along with exactly what you're doing. And we're actually going to help you save time because we're going to identify, again, what are the best joint range of motion to be in? What's the best exercise to use? What's the best loading principles to use? So we can actually help eliminate some exercises that are more just kind of fluff and creating fatigue and almost leading into more compensation. We can eliminate those exercises and identify which ones are most advantageous. And now let's make sure we load those. The buy-in from the athletes is significantly greater, right? Anytime you can tell an athlete, hey, instead of 8 exercises a day, we're only going to do 5, they love that, right? And they're going to attack those 5 exercises even harder, especially knowing that they can see the muscle contraction and they can kind of feel it a little bit better. I think too, like to your point of the isometric warm-up, we use PAP, and PAP is a popular component, training method. Nobody really does it for the trunk that much. And when you look at isometric torque that you can create with the trunk muscles before you're going to go do some med ball throwing routines and things like that, why would you not use it? And I think what we found with the Oro device, on a lot of these different positions, we can create an extremely high muscle response, and time to muscle contraction is really, really high, really fast. So it's almost an RFD of the trunk muscles, which are a little bit harder to, kind of isolate a little bit. And now when we go do our medicine ball throw routines and we're tracking medicine ball speed, it's drastically increased. I mean, we're getting a 20-30% increase in med ball velocity with a lot of these throws just by doing some ISO pre-work and creating PAP specifically for the trunk.
Yeah, and I mean, at the end of the day, the trunk and core musculature is crucial for pretty much everything that humans do. I don't care if it's sport performance or just general day-to-day movement. And you're absolutely right in the sense that we have huge disconnect there. We have a huge misunderstanding of training there, so much so that we're literally going to be doing an entire roundtable podcast on that very soon to try and kind of dive into that a little bit more. But to that point on sport performance a bit, I think everyone's kind of come to understand lower extremity injuries are common. Upper extremity injuries are common. We've got to train the arms. We've got to train the legs and so on that way. Yet when it comes to core, it's still getting just thrown in at the end of the workout real quick, a couple sets of like high volume crunches or, a couple like hollow holds or something like that. And I certainly think that when you watch sport occurs in a much different manner and different fashion. And even on that note as well, going back to what you mentioned before about the pail off press, right? Like that's something that pretty much everyone uses for quote unquote core training, when in reality, we're not nearly getting what we think we are from it. So understanding that we might need to redefine how we do everything, not just lower extremity, not just upper extremity, but even core. You mentioned another series of muscles earlier around the head and neck that way. And, I couldn't help but wonder, like, are people even training their necks anymore? And, I think about some of the different concussions that I've seen and the role of soft tissue muscle stabilizers playing in, just keeping the head and neck stable and just an overall shock absorption standpoint when we do get a hit to the head or a blow to the head that way. And it's like, why would we not consider looking into those things a little bit deeper? And certainly, I can't really speak to what we're going to find because I haven't looked into it myself, but I certainly think that there's a lot to unpack in this world, and there's a lot of things that we can do in the future to kind of do better by all of the athletes that we work with that way. And obviously, it's one of those things that I think some people are probably going to take this product, they're going to run with it, and they're going to publish a ton of really great work as far as like, hey, look, we use this exercise with 1,000 different people, and here's what we found. And then we can kind of have almost like standards developed off of the Surface EMG data that we have here to understand what exercises might be the best. But then we can also kind of develop a new set of exercises that are the best when X is present. The best exercise is to still load the quad when the patellar tendon, we have a patellar tendinopathy, or the best exercise is to load rotator cuff when we have a partial thickness tear of one of the rotator cuff muscles, or so on that way, right? Like there's so many different considerations and databases that can be built off of this. And I just think about how pretty much every coach and sports science guy has a drill library now based on GPS data. Well, the same can be done for exercises based on any set of parameters that you define that way, and then you can kind of take your exercise library to the 2024 standard, I guess I'll say.
Well, to your point of the trunk, when you look at upper and lower extremities, all of our, again, measurement tools are pretty much set only for the lower and upper extremities. There's not a whole lot of measurement diagnostic tools that really give you output measurements for the core. So again, now Surface EMG muscle, we're able to at least identify, are we able to get a high muscle response with certain movements? And then to your point of almost movement progressions, regressions, right? We all have them. We have here's where we're going to start with most athletes. Here's our end kind of game. And say it's a squat pattern, and you're going to start with just air squats, and then you're going to move to zombie squats, and then goblet, and then zercher, and then front and then back, whatever your squat progression is. You can actually kind of work through all of your different movement progressions and regressions and identify, okay, are they in the appropriate order that they should be in, right? And some of it could be based on purely on load. Some of it could be based on the compensations that we give you to perform the exercise a little bit better. But what we've done with our staff is, it's at least an N of 6. We've gone through a lot of our different movement progressions and really kind of identified, okay, across the board, when the goal is to really hit the anterior chain or the posterior chain or certain muscles, are we getting the best muscle response across the board when we all do this exercise? And we've actually kind of found a lot of times, again, especially the core, what our typical movement progressions would be. We've actually almost kind of reversed them a little bit, like a pull-off press and things like that. That should be your rudimentary introduction into some core activation, because it's such a low muscle response, and then build into a lot more of the static kind of yielding isometrics, and then some of those pushing isometric positions. So it's kind of helped us reorganize again our movement library to just better identify, okay, what is the most advantageous loading positions, and then what are the progressions on those that get an even higher muscle response.
As we've been talking, Mark, I realize we could probably go on about this pretty much all day long because there's a lot to unpack about this, and there's so many different application points as well that way. But, is there any kind of closing thoughts or closing remarks that you might have, or anything that we missed as we were chatting about Oro and the application of, a Surface EMG device that way across a variety of different settings and, under that general high performance umbrella?
I mean, I would just say, I think most people that we talk to as a company tend to be a little bit scared of EMG, and a lot of it's just because of the research that's been out there. And there are with certain tools, certain diagnostic tools from a Surface EMG standpoint, there could be a lot of movement artifacts, so it's not as valid. That is almost a blessing to our ears when we hear that, because we have the solution for you. We've got a medically validated device that can actually kind of solve what everyone's problems are, right? And a lot of us might not even be aware there is that problem because we're not even thinking about it from that standpoint. So we're kind of, answering those questions that you have before you even have those questions because we have that solution for you. And I think that's the real exciting thing is, this company is taking off. It's a newer company, but obviously been around for a long time because they went through an extensive validation process. And as our professional sports teams that use it have been using it throughout their competitive seasons, they want more and more because they see the immediate impact, the immediate value. I've seen it, with my day-to-day practice. I think that's one of those things that it's easy to be intimidated by new technology, especially when it is like surface EMG. But as you research more, as you identify more, as you look up our company, as you follow on social media and look at the website and see all the different things that we're putting out and coming up with, you shouldn't be scared of EMG anymore because we've kind of found that solution for you.
Yeah, no, definitely. And I think that's one of the most essential elements is taking, some really good technology and making it accessible and applicable to what athletes do or what we need athletes to be doing and considering on the day-to-day that way. So I think that's a great point and great takeaway, Mark, for people who want to find out more about you and the work that you do on the high performance side, and for people who want to find out more about Oro and the company that way. Where can they find out all of those things at?
So myself I just from a social media standpoint just do LinkedIn and Instagram at Coach Jamison HPC. My high performance consulting company that I'll do with and a lot of return to play consulting with athletes with teams and organizations. And put some other resources out. We try to work with a lot of like local high schools because I think as I'm sure you found there's not a lot that have certified strength and conditioning coaches. So trying to provide obviously as much as we can, at least resources for them, at least education to try to help those athletes and mitigate the injury risk that there might be. And then at Oro Muscles would be the social media handle, and then oromuscles.com to learn more about the company and what we provide.
Awesome. We'll link to all of that in the description below. That way, if you didn't quite catch it, you can just click there to learn more. Mark, this was amazing. I really appreciate your time today, man. Thanks for being here.
Awesome. Thanks for having me on.